Hello, friends. I am Dr. Pavan Kumar, Senior Consultant Cardiovascular Surgeon, practicing at SL Raheja Fortis Associate Hospital, Mumbai, India. I've been in this field practicing adult cardiac surgery over the last 3 decades, more than 3 decades. I came to Mumbai in 1992, and since then I've been practicing heart surgery in various prestigious hospitals in Mumbai. And today is an opportunity where I want to discuss with you one of the very important surgeries which we perform. More than 70% of our practice is coronary artery bypass surgery. As you know, the heart attack disease and coronary artery disease is the rampant in our country, and every year there are 18 million people die in the world because of the heart attack disease. So it's a very important disease, lethal disease, and it causes lots of mortality in the world. So as we do bypass surgery for heart attack disease, I thought it's a good time to discuss about this main surgery where we perform almost 70% of our work as a coronary artery bypass surgery. What is coronary bypass surgery? What is their benefit? What is the long-term result? How patients do well? This all we'll discuss in today's talk. As I explained to you that I've been practicing the cardiac surgery, adult cardiac surgery in Mumbai over the last 32 years, and my almost I have done more than 10,000 heart surgeries in these time, and main work is basically coronary bypass surgery. Why coronary bypass surgery is required? What are the indications of coronary bypass surgery? This surgery is basically for heart attack disease or the blockages in coronary arteries. What are the coronary arteries? Coronary arteries are the vessels which supply blood to your heart. If you see on the screen, there is a diagram, coronary artery anatomy, where you see that there are many coronary arteries, the left coronary artery and the right coronary artery. And the left coronary artery starts from the left main coronary artery and divides into left anterior descending artery and the left circumflex artery. And the right coronary artery supplies the right side of the heart, and it also divides into PDA and the PLV arteries. So these are the 5 main vessels of coronary system which supply fresh blood to your heart. And blockages in these arteries, they are called as coronary artery disease. Blockages occur because of the atherosclerosis or cholesterol deposit or excessive exercise driven damage to the coronary arteries, or diabetes also damages these arteries. Once the blockages develop, you develop a heart attack disease or coronary artery disease. And when blocks are many, now when do we do bypass surgery? Basically, not all patients, those who have heart attack disease or coronary artery disease, require bypass surgery. Only 10% to 15% patients require coronary artery bypass surgery. Rest of the can be managed, almost 40 to 50% patients can be managed by medical management, diet adjustment, lifestyle changes. Some 30% patients may require stenting, coronary artery stenting. And then only 10 to 15% patients require coronary bypass surgery. So that fear that everybody who has a heart attack will require a bypass surgery is unfounded. So indications for coronary bypass surgery are that if there are blockages in all these 3 vessels, the left anterior descending artery, circumflex artery, right coronary artery, all of them are blocked, then bypass surgery is the preferred option, treatment. Left main disease, as you know, the left system starts as a left main stem, the origin of the left system. So this is origin, and any blockage in this origin of left main will be benefited by bypass surgery. Stenting at left main is not advisable. Then there are cases where we have already stents put in their coronary arteries, and as you know, stents do get blocked off the recurrence rate depends upon their risk factors, but even then, 5% to 7% stents do get blocked up every year because of various reasons. So in those cases also, we will have to ultimately do coronary artery bypass surgery. Then those patients who have had a heart attack and their coronary arteries are 100% occluded, but still they have symptoms, angina or chest pain, then we investigate them and find out if they will benefit from new blood supply, then they will go for coronary artery bypass surgery. Then those who have diabetes, especially nowadays, almost 70 to 80% patients have diabetes. And world research has shown, like Freedom Trial has shown very clearly, that coronary artery bypass surgery is a better treatment option as compared to stenting, because stents do get earlier blocked as compared to coronary artery bypass surgery.
Yes.
And you also have a better outcome with arterial type of bypass surgery in these diabetic patients, those who also have coronary artery disease.
Yes.
And lastly, the poor heart function. Poor heart function is when person has had multiple heart attacks and his heart function has gone down from above 50% to 30-35%. There are various trials available to us, like Syntex trial, where it is shown very clearly that in poor heart function, stents are not advisable, and bypass surgery improves heart function and is a preferred treatment of choice.
Yes.
Next is what are those risk factors which are usually associated diseases when we perform coronary bypass surgery. As you know, coronary artery disease is not a single organ disease. Atherosclerosis occurs across the body, and these patients also have multiple diseases. What we face, they may have diabetes, controlled or uncontrolled or insulin-dependent diabetes. They may have kidney dysfunction because of various reasons, where creatinine is up. Then these people are usually obese. There's also a risk factor associated when we perform bypass surgery in these patients. These patients may have a COPD, lung dysfunction, or they may have brain stroke. And they may have undergone a cancer therapy by radiotherapy or chemotherapy, where lots of changes occur in and around heart and in and around body. And some patients, those who have immune deficiency diseases where infection is very common, yet we have to perform a bypass surgery for their further line of treatment or management. Then we get patients nowadays which are beyond 75 years age. There's another risk factor. Nowadays, in fact, we get younger patients, less than 40 years of age, and that is also with lots of disease in their body. So these are the risk factors which we face while performing bypass surgery, and associated diseases which we face and tackle before we let them undergo bypass surgery. Now, how do we make the body fit for the bypass surgery in these conditions, these risk factors which I enumerated? So let's go back to the diabetes. We control diabetes very strictly. We optimize the body status, the nutritional status. If they are anemic, we boost up the hemoglobin before we take up the surgery. If kidney dysfunction is there, then we optimize the kidney status, assess the kidney function, then give them a kidney protective agents, and then we deploy special protocols in doing bypass surgery in these patients. Patient has obesity, then again we optimize the body function, their physiotherapy, their lung function status, improve the lung function status so that they can safely undergo bypass surgery and come out of ICU in the scheduled time. Then other factors like age, again, is a very important thing to tackle, because in older age, the whole organs are very weak, and they have to be stabilized and they have to be perfected before we take them for surgery. Now, what are the post-surgery care? As you know, the bypass surgery is a process where we supply blood beyond blocks. So coronary bypass surgery produces new blood supply beyond coronary artery blocks. So that is what is called as coronary bypass surgery. We perform these surgeries in different manners, like we perform them on pump, we perform on beating heart surgery, we perform minimally invasive surgery, and there are different kind of conduits which we use to bypass those blocks. Arterial type of conduits which are available in your body, like left internal mammary artery, right mammary artery, radial artery, and then great saphenous vein from the thigh. So these are the conduits which we use in coronary artery bypass surgery. They are either supplying blood independent from their origin, or they are in a different cross anastomosis fashion. We do so that blood supply is restored in the blocked arteries, the blocked coronary arteries. So these are the different techniques which we deploy doing bypass surgery. All these techniques are patient specific, their disease is specific, and their body specific, so that it is not it is tailor made for a patient condition, so that they get the optimal benefit of coronary artery bypass surgery. After doing surgery, what are the post surgery care after operation? It is very important that once we prepare the body, our patient, for their optimal status in to undergo coronary bypass surgery, so that they can safely come out of ICU and go to the ward in the scheduled time. So their care is very important. Care means their diabetes status, their risk factors, their hypertension, blood pressure has to be controlled. If there is a physiotherapy required, physiotherapy is very important. So these are the care given in a specialist hospital, so that they get best care after surgery. Now, what are the benefits of bypass surgery? You should know why bypass surgery is to be done. What kind of benefit a patient gets after bypass surgery. As you know, these patients are crippled before surgery. They get angina continuously. When they walk, they do exercise, they climb stairs, they get angina. Angina means they get chest pain, or pain referred to the shoulder, referred to the jaw, or pain after meals. So these are the angina. So this angina gets reduced or disappears. So there's one benefit, that is relief from symptoms. Also, these patients are on multiple drugs, maybe more than 10 medications, including the diabetic medications, anti-diabetic drugs, anti-hypertensive drugs, and other disease drugs. So after bypass surgery, usually there is a great reduction in medications, so that these medications are reduced to maybe 3-4 medicines, that's all. And then important point is that once we restore the blood supply in coronary arteries, their heart function improves. So that what was the heart function before surgery, it improves tremendously to 20% to 25% to 30%. Almost in some cases, I've seen the heart function returning back to normal heart function. And it also allows us, the new blood supply to the coronary arteries allows protection from further heart attacks, because new blood supply is restored, then the further heart attacks will be minimized because of the new blood supply is restored to the heart. So these are the benefits which you will get after bypass surgery. Now, what is life after operation? You know, CBG is not the end, it is the new beginning of your life. Bypass surgery is not just a heart surgery, you know, it's a second chance at life. And now your body has evolved in a much better way to tackle heart attacks or other problems in your life. And in expert hands, it is in better equipped hospitals. Its bypass surgery offers not only just improved survival, but also improved quality of life, recovery, and longevity of the life. So that is the life after operation. So you should not fear of this bypass surgery. If you have undergone a heart attack, disease, or something, there is no need to fear. Bypass surgery will restore your confidence in yourself to lead a normal life. Now, what are the long-term success results of bypass surgery? A very important question in people's mind, in their treating doctors' mind, and what are the success rates of bypass surgery? I have been practicing heart surgery over the last 32 years, and especially the coronary bypass surgery is my forte. And I have been doing this surgery over the last so many decades. And those patients, those whom I operated in 90s, are still alive and doing very well. There are many, many examples, those who undergone surgery 20, 25 years. Now, how does this happen? How does this long-term success occur? Whether it is both the surgical skill, how you take your conduits, how do you harvest their conduits, how do you use this in surgical field to restore blood supply, what is the native coronary artery disease, and how the surgery was performed. Once it is performed in expert manner, in a skilled manner, that part is over. But the surgery success in long term depends upon the follow-ups, strict protocols for various risk factors. I encourage my patients to have a risk factor analysis before surgery and ask them to control their risk factors very strictly. They come to me every now and then, yearly follow-ups. I take their risk factors in due consideration, whether if they have diabetes. So I want them to be absolutely controlling their diabetes under control. The HbA1c should be less than 6 or so. Whether they have to take medications for that or they have to change their lifestyle, it is very important. If their hypertension, their blood pressure is high, blood pressure has to be strictly under control, because blood pressure itself is a very independent risk factor for graft failures. Then if they have obesity, I strictly want them to reduce their weight to become basically a normal body person. Whether they require lifestyle changes or not, it depends upon them. I guide them. We basically counsel them for controlling their body weight. Then if there are any other risk factors like smoking, drinking, or junk food eating, all these things require lifestyle modification. I strongly advise to my patients that if you have any of these risk factors, you must quit. At least I advise them, so that they quit smoking, they quit drinking, or they stop taking junk foods, and healthy lifestyle is most important. Then at the same time, very important, what kind of personality they have. If you understand that heart attack disease is also caused by type A personality, person who is running, person who is angry all the time. So they have to modify their personalities, because what happens in anger, body secretes hormones from the brain and they constrict vessels, and that's the main cause of heart attacks. So it is better that I and at the same time the patient himself should seek a lifestyle coach and reduce their anger, or change their type A personality to more subdued way of living a life. So these are the factors which are important for giving long-term success to your bypass surgery. At the same time, they have to be put on certain medications, which we usually advise. One is a small amount of blood thinners, especially if you do arterial type of bypass surgery, even the blood thinners may not be required, but native disease may be there. So that for that, you might require a small amount of blood thinners. And statins are basically lipid lowering agents. Usually, if they are not able to control their obesity, their atherosclerosis, some amount of statins are required. Statins also have shown a great protective effect on the grafts. So some amount of statins are advised, so that they keep their lipid profile, the cholesterol, within limits. The bad cholesterol should be under control. Good cholesterol should be as high as possible. And also, I advise them to do their heart rate under control. For that, we give sometimes some small amount of beta blockers and some amount of blood flow improving medications like nitrates. If they can undergo lifestyle changes, along with the dietary control and strict risk factor control, bypass surgery can last as long as 20-25 years. I have patients with me, those who have survived. Now they are in their 80s, those whom I operated in 90s. So it's almost 25-30 years of long-term success in these patients. So bypass surgery, you can always look towards a very good success throughout 20-25 years of your life. It is a one-time job. If done in expert hands with the skilled technique of newer methods of bypass surgery, it gives you great long-term success. What is my experience of bypass surgery? Basically, I have been practicing bypass surgery over last 35 years, and performed over more than 10,000 bypass surgeries in this city and in India. It has been a great success story. Lots of patients, those whom I operated in the 90s, have been doing very well. And whatever these patients are there, they know me that I have been very strict in following the protocols, managing their risk factors, guiding them towards their lifestyle changes so that they get the best benefit of bypass surgery. Bypass surgery is not a thing which should be taken lightly, and bypass surgery is done in skilled hands with the expertise will give you the best chance, and it is a second life. One should think about it, so that it is not an end, it is a new beginning. And it offers not only just improved survival, but also it improves your quality of life and its recovery and longevity. Thank you very much.